Have you been feeling constant acidity, burning in your stomach, or bloating after every meal, and you keep thinking it's just gas or normal indigestion? What if I told you that for many seniors, what looks like simple acidity is actually caused by a hidden infection living inside the stomach? Yes, a real infection that can stay in your body for years without you even knowing. And the scary part is that most people keep taking antacids, home remedies, or pain medicines, but the real cause never goes away. In fact, it slowly keeps damaging the stomach lining day after day. Today, I want to talk about something very important, especially for seniors over 55. There are certain warning signs your body gives when acidity is not just acidity anymore, but could be a Helicobacter pylori infection, often called H. pylori. This bacteria is very common, but in older adults it can become dangerous if ignored. It can lead to ulcers, severe stomach inflammation, vitamin deficiencies, and in some cases, even stomach cancer if left untreated for a long time. Many people live with this infection for years, thinking they only have weak digestion. So in this video, I'm going to explain 5 warning signs that your acidity may actually be H. pylori infection, and why you should never ignore these symptoms, especially if you are a senior. You know, many people tell me that they have had acidity for years. They say, I just can't eat spicy food anymore. I always feel burning. I take medicine and it gets better for a while, then it comes back again. If this sounds like you, then this is the first warning sign you need to understand. When acidity keeps coming back again and again, no matter what you eat, no matter what medicine you take, it may not be simple acid problem. H. pylori bacteria lives in the stomach lining and weakens the natural protective layer of the stomach. Because of this, acid starts irritating the stomach walls more easily. That is why the burning feeling keeps returning. Many seniors think their stomach is weak because of age, but in reality, the infection is still there, quietly causing inflammation every day. Temporary medicines reduce acid, but they do not kill the bacteria, so the problem keeps coming back. If your acidity never fully goes away and keeps returning after weeks or months, this is not normal and should not be ignored. Another sign that many seniors notice but don't connect with stomach infection is feeling full very quickly, even after eating a small amount of food. You sit down to eat, you take a few bites, and suddenly you feel heavy, bloated, or uncomfortable. Some people think their appetite is gone because they are getting older, but that is not always true. When H. pylori infects the stomach, it causes inflammation in the stomach lining. This inflammation makes digestion slower and less comfortable. Food stays in the stomach longer, and that creates a feeling of fullness even when you haven't eaten much. Over time, this can lead to poor nutrition, weakness, and weight loss, especially in seniors who already eat less than before. If you notice that your appetite has changed without any clear reason, and you feel bloated or uncomfortable after small meals, your body may be telling you that something inside the stomach is not right. There is another warning sign that many people ignore because it feels very common, and that is frequent burping, gas, and bad taste in the mouth. People often say, I just have gas problem, my digestion is slow, I need to avoid certain foods. But when gas and burping happen every day, especially along with burning or stomach discomfort, it could be related to H. pylori infection. This bacteria changes the balance of acid in the stomach and also affects how food is broken down. Because of that, more gas is produced, and the stomach may feel swollen or tight. Some people also notice a sour or bitter taste in their mouth, especially in the morning. This happens because stomach acid and digestive fluids move upward more easily when the stomach lining is irritated. Seniors often take antacids for this, but again, those medicines only control symptoms for a short time. If the real cause is infection, the problem keeps returning again and again. Now there is one warning sign that should never be ignored, especially at an older age, and that is unexplained weight loss or constant weakness. Many seniors think losing weight is normal as they age, but sudden or ongoing weight loss without trying is not normal. When H. pylori infection stays in the stomach for a long time, it can reduce appetite, cause nausea, and make digestion less effective. The body does not absorb nutrients properly, and slowly the person becomes weaker. Some people also feel tired all the time, even if they sleep well. This happens because the infection can affect vitamin absorption, especially vitamin B12 and iron, which are very important for energy and blood health. Over time, this can lead to anemia, dizziness, and low strength. If you feel weaker than before, get tired easily, or notice weight loss without changing your diet, it is important to check the stomach instead of assuming it is just age. Another serious warning sign that many seniors feel but don't talk about is stomach pain that comes and goes, especially when the stomach is empty. Some people feel pain early in the morning or between meals or late at night. They eat something and the pain gets better for a while, then comes back again later. This kind of pain can happen when the stomach lining is damaged by H. pylori bacteria. Over time, this damage can turn into ulcers, which are small sores in the stomach wall. Ulcers can cause burning pain, sharp discomfort, nausea, and sometimes even bleeding if they become severe. Many people keep taking painkillers or acidity medicine without knowing that the real problem is an infection. In seniors, ulcers can become dangerous because healing is slower and the risk of complications is higher. If you feel repeated stomach pain, especially when hungry, your body may be giving you an early warning that something more serious is happening inside. Now you may be wondering how this infection happens in the first place. H. pylori is a very common bacteria, and many people get it earlier in life without knowing. It can spread through food, water, or close contact, especially in places where hygiene conditions were not perfect in the past. The problem is that the bacteria can stay in the stomach for decades without causing strong symptoms at first. As people get older, the stomach becomes more sensitive, the immune system becomes weaker, and the infection starts causing more damage. That is why many seniors suddenly develop acidity, ulcers, or digestion problems, even if they were fine before. It is not always new disease. Sometimes it is an old infection that is now becoming active. One mistake many seniors make is taking pain medicines very often, for joint pain, back pain, or headaches. Medicines like anti-inflammatory tablets can irritate the stomach lining. If H. pylori infection is already present, these medicines can make the damage worse. The stomach becomes more sensitive, ulcers form more easily, and burning feeling becomes stronger. This is why doctors often check for H. pylori when someone has long-term stomach problems, especially if they also take pain medicines regularly. Protecting the stomach becomes more important as we age, because the body does not recover as quickly as it did before. The good news is that H. pylori infection can be detected with simple tests. Doctors may recommend a breath test, stool test, or blood test to check for the bacteria. In some cases, they may suggest endoscopy to look inside the stomach, especially if symptoms are severe or have been present for a long time. Many people feel scared when they hear about tests, but finding the real cause is always better than guessing. Once the infection is confirmed, treatment usually includes specific antibiotics, along with medicines that reduce stomach acid. This combination helps kill the bacteria and allows the stomach lining to heal. Most people start feeling better after proper treatment, but it is important to complete the full course of medicine. Along with treatment, there are also some habits that help the stomach heal faster. Eating smaller meals, avoiding very spicy or oily food, reducing tea and coffee, and not lying down immediately after eating can reduce irritation. Stress can also make stomach symptoms worse, so staying relaxed and keeping a regular eating schedule helps more than people think. Drinking enough water and eating simple, home-cooked food is often better than taking too many medicines without knowing the cause. Many seniors live with stomach discomfort for years because they think it is normal at their age. They say everyone has gas, everyone has acidity. This is just part of getting older. But your body always gives signals when something is wrong. Burning that never stops, bloating after every meal, pain when the stomach is empty, feeling weak without reason, losing appetite. These are not things you should ignore. Sometimes the problem is small, but sometimes it is the sign of an infection that needs proper treatment. If you or someone in your family has been dealing with acidity for a long time, it may be time to look deeper instead of just taking another antacid tablet. The sooner the real cause is found, the easier it is to treat. H. pylori infection is common, but when ignored for years, it can lead to serious stomach problems, especially in seniors. Taking care of your stomach is not only about comfort, it is about protecting your overall health, your strength, and your quality of life as you grow older. Your stomach works every single day without rest, helping your body get the energy it needs. When something inside is not right, the whole body feels it. That is why listening to these warning signs can make a big difference. Many people wish they had checked earlier instead of ignoring symptoms for years. Paying attention now can prevent bigger problems later, and that is exactly why understanding these 5 warning signs is so important for every senior who thinks their acidity is just acidity, when in reality, their body may be asking for help. Another warning sign many seniors notice, but often ignore, is frequent nausea in the morning, even without eating anything. You wake up, your stomach is empty, you haven't had tea, you haven't had breakfast, yet there is a strange, uneasy feeling inside the stomach. Some people describe it as a sick feeling. Some say it feels like something is stuck, and others say it feels like the stomach is irritated for no reason. Because this happens in the morning, many seniors think it is just because the stomach is empty, or because they slept late, or ate something heavy the night before. But when this feeling keeps happening again and again, day after day, week after week, it may not be normal acidity. It can be a sign that the stomach lining is inflamed, and one of the most common causes of long-term stomach inflammation in older adults is H. pylori infection. When this bacteria lives in the stomach, it damages the protective layer that normally keeps acid from hurting the stomach walls. The stomach always produces acid, even when you are not eating, but normally the lining protects itself. With H. pylori infection, that protection becomes weaker. During the night, when the stomach stays empty for many hours, acid keeps touching the irritated lining, and by morning the stomach feels sore, sensitive, and uncomfortable. That is why many seniors feel nausea right after waking up, even before drinking water. This is not the same as simple hunger. Hunger usually feels like emptiness, but infection-related nausea feels like irritation, heaviness, or sickness inside the stomach. Some people try to fix this by drinking tea immediately after waking up, thinking it will settle the stomach. Sometimes it gives temporary relief, but the problem returns the next day. Others take antacid syrup every morning, and for a few hours they feel fine, but the nausea comes back again the next day. This pattern is very common when the real cause is not too much acid, but infection causing inflammation. Medicines that reduce acid can calm the stomach for a short time, but they do not remove the bacteria, so the irritation continues. Morning nausea can also make seniors lose their appetite without realizing why. When the stomach feels sick early in the day, the person may skip breakfast or eat very little. Over time, this habit can lead to weakness, low energy, and poor nutrition. Many older adults already eat less than they used to, and when nausea makes them avoid food even more, the body does not get enough vitamins, protein, and minerals. This can slowly affect strength, immunity, and overall health. Sometimes family members think the person is just not interested in food anymore because of age, but the real reason may be that the stomach does not feel comfortable in the morning. Another thing that often happens with H. pylori infection is that nausea may come with a slight burning feeling in the upper stomach or chest. It may not be very strong, but it is there, especially when the stomach is empty. Some people say they feel better after eating something small, while others feel worse after eating. This difference happens because every stomach reacts differently when the lining is irritated. In some people, food protects the stomach for a while, and in others, food makes acid production increase, which causes more discomfort. Because the symptoms change from person to person, many seniors get confused and keep guessing the cause instead of checking for infection. Morning nausea can also be connected with a sour taste in the mouth, or feeling like acid is coming upward. When the stomach lining is inflamed, the normal movement of digestion becomes disturbed. Acid and digestive juices may move upward more easily, especially after lying down all night. That is why some people wake up with bad taste, mild nausea, or a feeling that the stomach is not settled. They may brush their teeth, drink water, or eat something light, and the feeling improves, but the next morning it happens again. When this keeps repeating for months, it should not be ignored. In seniors, this symptom is even more important to notice, because the stomach becomes more sensitive with age. The body does not heal as quickly as before, and infections that stayed silent for years can start causing problems later in life. Many people get H. pylori infection when they are younger, but the symptoms appear only after 50 or 60, when the stomach lining becomes weaker. This is why a person who never had stomach trouble before may suddenly start feeling nausea, acidity, or discomfort in older age. Another reason morning nausea should not be ignored is that it can sometimes be an early sign of ulcers forming in the stomach. When H. pylori stays for a long time, it can create small sores in the stomach lining. These sores become more painful when the stomach is empty because acid directly touches the damaged area. During the night, the stomach stays empty for many hours, so in the morning the irritation feels stronger. The person may not feel sharp pain yet, only nausea or discomfort, but this can be the early stage of a bigger problem. Finding the cause early makes treatment easier and prevents complications later. Some seniors also notice that along with morning nausea, they feel tired or dizzy more often. This can happen because long-term stomach infection can affect how the body absorbs important nutrients. Vitamin B12 and iron are especially important for energy and blood health, and these are absorbed in the digestive system. When the stomach lining is inflamed, absorption becomes weaker. Over time, the body may develop low levels of these nutrients, which can cause fatigue, weakness, pale skin, and low stamina. Because these changes happen slowly, many people think it is just normal aging, but sometimes the stomach problem is the hidden cause. Another thing to understand is that H. pylori infection does not always cause strong pain. Many seniors expect that if something is wrong in the stomach, the pain will be severe. But this infection often causes mild, repeated symptoms instead of one big symptom. Nausea, bloating, burning, loss of appetite, bad taste, and discomfort may come and go, so the person keeps ignoring them. Over time, this delay allows the infection to stay longer and cause more damage. That is why small symptoms that keep repeating are more important than one strong symptom that happens once. Morning nausea can also become worse if a person takes pain medicines regularly. Many seniors take tablets for joint pain, back pain, or headaches. These medicines can irritate the stomach lining, and if H. pylori is already present, the irritation becomes stronger. The stomach becomes more sensitive, and nausea may appear more often, especially when the stomach is empty. Some people think the medicine alone is causing the problem, but sometimes the medicine only makes an existing infection more noticeable. This is why doctors often ask about stomach symptoms before giving long-term pain medicines to older patients. It is also common for people with H. pylori infection to feel that their digestion is never fully normal. One day they feel fine, the next day they feel sick. One week the acidity is strong, the next week it is mild. This changing pattern makes people think the problem is just food-related, but infection often behaves this way. The bacteria keeps irritating the stomach slowly, so symptoms appear again and again, instead of staying constant. Some seniors also feel slight nausea when they smell food in the morning, even if they like that food normally. This happens because the stomach is already irritated, and the body reacts more strongly to smells when it feels sick. Others feel that they want to eat but cannot eat much, because after a few bites, the stomach feels uncomfortable. These small changes in appetite are easy to ignore, but they can be signs that the stomach lining is not healthy. Doctors usually recommend testing for H. pylori when symptoms like repeated nausea, long-term acidity, or stomach discomfort do not improve with normal treatment. The tests are simple and do not take much time. Once the infection is found, treatment can remove the bacteria and allow the stomach to heal. Many people feel a big difference after proper treatment, especially those who had symptoms for years without knowing the cause. It is important for seniors to remember that the body changes with age, but constant stomach discomfort is not something you should accept as normal. Feeling nausea every morning is not just a small problem if it keeps happening again and again. The stomach is trying to tell you that something is wrong inside, and ignoring it only allows the irritation to continue. When the cause is found early, the stomach can heal, digestion becomes easier, and energy slowly comes back. Many people say they wish they had checked earlier, instead of living with nausea for years. They kept thinking it was gas, acidity, or weak digestion, but after proper testing they found infection was the real reason. Once treated, the morning sickness feeling disappeared, appetite improved, and they felt lighter and more comfortable during the day. This shows how important it is to listen to the body, especially when the same symptom keeps repeating without clear reason.